Welcome to the Heart Talk, a podcast dedicated to empowering you with the knowledge and habits that keep your heart strong and healthy. In today's fast-paced world, where stress is high, lifestyles are sedentary, and processed foods often replace wholesome meals, heart disease has become one of the world's leading health concerns. And alarmingly, it's affecting younger people more than ever before. Hi, I'm Huma Qureshi, and in this episode, we're joined by a leading physician to help us understand how we can protect our hearts, detect early warning signs, and make choices that ensure a longer, healthier life. Together, we break down the science into simple, actionable steps that you can start today, because a healthier heart means a healthier you. So, doctor, tell me, why are so many people today, younger people, even celebrities, getting heart attacks at just 40? I mean, aren't heart problems for older people?
I am Dr. Parijat Deb Choudhury, consultant interventional cardiologist. I am from Kolkata, Manipal Hospital and Medithics Clinic, Mukundapur. Actually, heart disease is no more a disease of elderly. Nowadays, many young people are getting heart attack. We very frequently hear that people who are less than 40 years of age are suffering from heart attack. And this is not only common in India, it is very common in South Asian countries. Many reasons are responsible for that: excessive stress, obesity, overactivity, sometimes due to diabetes, hypertension, dyslipidemia. All these things can lead to increased risks of heart attack. And this heart attack can happen in people who are looking very fit. Some people, they go to gym regularly, they go for a healthy diet, but still they might be genetically predisposed to high risks of heart attack. So we have to be very careful. If there is genetic risk of heart attack or a heart disease in family, then they have to take extra care so that they do not suffer from any heart related problem.
So, what are the warning signs that I should never ignore when it comes to my heart? And when should I see a doctor?
Whenever there is a heart related problem, usually the body gives some warning signs. There are few symptoms which are very common before a heart attack. Most common is chest pain. Usually chest pain is central in the mid of the chest. It can radiate to the hand, it can come up to the jaw, can go up to the back upper part. This chest pain many of the times is associated with shortness of breath. There is palpitation, fatigue, cold sweat is very common before heart attack. Sometimes there is a feeling of impending doom, like the person feels that there is something wrong in the body. He might not explain it. All these symptoms, if associated, you should never ignore it. Should go to a cardiologist immediately to find out if there is any cardiac issues. A normal ECG, echocardiography can find out if there is any heart related problem. Remember that if there is any heart disease or any heart attack situation, proper treatment on time can save a life. So always be on time.
And what are the most important daily habits that people can adopt to keep their heart healthy and to reduce the risk of heart disease? And what are the daily habits that people can use to keep their heart healthy and reduce the risk of heart disease?
There are some daily micro habits which you can follow to keep your heart healthy. Most important is exercise. Daily exercise of at least 30 minutes, at least 5 times in a week is very important to keep our heart going. Next is diet. A diet rich in fruits and vegetables and low in salt and sugar is very important to keep your heart healthy. Stop smoking, avoid too much of alcohol. If somebody is diabetic or hypertensive, you should keep it under control by medication. Check your dyslipidemia. If cholesterol level is high, it can cause atherosclerotic cardiac disease. So you have to reduce your cholesterol by diet, exercise, and by medication. Do not take excessive stress because stress is one of the most important cause of heart attack nowadays. Try to move around, avoid excessive stress, sleep well. So if somebody is overweight, then reduce the weight. And after all this, if you are more than 30 years of age, you have to go for regular screening to find out if anything is hidden inside. If all these things can be followed, then heart attack can be prevented.
How much do diet and physical activity actually affect your heart health, and what are your top recommendations?
Almost 80% of the heart attack is preventable. Actually, it's a good news. So basically, it depends on diet and exercise. A healthy diet and a regular exercise protocol actually can prevent heart attack. Now, what should be the diet? A heart healthy diet is rich in a high protein. It is rich in fruits, green vegetables, and should be low in carbohydrate and fat. And we should also avoid processed food, should avoid outside junk food, and try to consume more and more of the protein food. Apart from that, doing regular activity, just like going for a walk or going for a cycling, swimming, all these things are very important. Should exercise daily, at least for 30 to 45 minutes. And also avoiding stress is important. Apart from that, one thing is very important. Rather than going for very dramatic changes, we should try to follow a proper diet and exercise protocol daily, which we can stick around. One day if we go for a very strict diet and next day if we take junk food, then it won't help our heart. So it is very important to go for a regular exercise and diet protocol which is easy to follow. If we can keep our diet and exercise properly, and if we sleep well, avoid excessive stress, go for regular screening, then a heart attack can be prevented, and almost 80% of the heart disease this way can be prevented, and untimely death also can be stopped.
What about stress? Does stress actually affect the heart, and what are the practical steps that one can take to reduce it?
Chronic stress can affect our heart. It is already scientifically proven that too much of stress can cause a heart attack. There are few methods which can be followed to reduce stress. Regular exercise, doing yoga or meditation, or sleeping for at least 6 to 8 hours daily can help reduce our stress level. If somebody is depressed, then they should take care of that. If someone is there at home to talk to, then we should go and talk to them to reduce our stress level. Also, to follow our hobby is important, because by following our hobby, we can reduce our stress level. Chronic stress is one of those things which can be managed easily to reduce our heart related problem. And I hope all of us, whoever is listening this, are taking care of their health and try to keep your diet and exercise protocol ready. If any problem, go and show to your doctor. Regular checking of diabetes, hypertension and cholesterol level is important. And I hope you are always healthy and happy and your heart is always young. Thank you.
Well, as we wrap up today's conversation, remember, your heart's health is in your hands. Every small change you make, from the food you eat, the way you move, and how you manage stress, adds up to a stronger, longer life. We hope the insights have inspired you to take those steps starting today. After all, your heart works for you 24/7. It deserves the same care and commitment from you. Thank you for tuning in. Until next time, keep your heart happy and it will keep you going strong.